So there's something out there that you know can save your sick child's life, but the price tag could be something unimaginable, like $800,000 when it's all said and done, between all the costs that would surround their care. It can be devastating and overwhelming when all you want to do is focus on your child's health. The Children's Organ Transplant Association, or COTA, stands with families trying to carry the financial burden of healing their kids. One of those families is the Venturas of Fair Oaks. We've got Erica, Maddox, and Livia with me now, along with Christy Brown, COTA's Chief Development Officer. Good morning, everybody.
Good morning.
Good morning.
Thank you so much for being here. Now, Erica, you are the proud mom of Livia and Maddox, and they both need kidney and liver transplants. They've been struggling with ARPKD, which stands for autosomal recessive polycystic kidney disease, their whole lives. Maddox, Livia, what's been the most difficult part of that?
I think one of the most difficult parts for me is probably just maybe just getting through it and just fighting through the battle,
I would say for me it's probably more emotional at this point, since my kidney disease has progressed, but not to the point where it's seriously affecting my day-to-day life, but more emotionally, and not being able to do certain things with my friends because I can get tired more easily than others. And I'm in the hospital a lot, which can set me back in school. And
That's very tough. And Erica, you're working with the great doctors at UCSF Health in San Francisco to get these transplants done, but the costs, not only for the surgery, but for things like medication, transportation, lodging for parents like yourself when you're not working as you help care for your kids, those costs can be more than $1 million. How does anybody do that? Do you just live in constant panic?
Well, pretty much. Yeah, but that's part of the reason why we teamed up with COTA when we started our transplant journey down at UCSF. One of the social workers recommended COTA to us as a resource to help us fund some of these costs. And transplants are wildly expensive, and insurance doesn't cover everything. They typically are covering about 80%. And additional things like housing. We're going to be out of town, so we have to rehome for each one of the kids up to 3 months. And things like that.
Okay. Christy, let's bring you in here. Your organization, COTA, the Children's Organ Transplant Association, is a national charity dedicated to helping communities raise money for transplant-related expenses for Maddox and Livia and about 2,400 other patients like them over the last 37 years. What kind of assistance does COTA provide? How do you help them start raising money?
Thanks. Well, we work with community volunteers. COTA, as you mentioned, has been around for nearly 38 years, and we partner with community volunteers that raise funds for COTA in honor of transplant patients. And then COTA uses the funds that are raised to help with those expenses that Erica mentioned. We want to make sure that families can focus on their children and young adults and not have to worry about the stress that the financial burden places on them as they're facing a transplant journey.
Okay, we're going to talk a little bit more about this fundraising effort in Fair Oaks, but first, as we do, we're going to put up the information our viewers would need if they want to send along a check to help with this effort. You can mail that check to COTA at 2502 West COTA Drive in Bloomington, Indiana, 47403. Check should be made payable to COTA in honor of Team Ventura. Put that on the memo line. And Christy, funds raised are actually available to patients for their entire lifetime?
That's correct. When a family partners with COTA, it's a lifetime relationship because we know the transplant journey is a lifetime journey. And so the funds we raise will be available to help with expenses now at the time of transplant and for ongoing expenses like transportation, anti-rejection medications, just all of those expenses that will continue to be necessary for the family.
Erica?
And I want to mention also that when funds are raised, 100% of the contributions are used only for transplant-related expenses. COTA doesn't charge any fees for our services, so every dollar raised goes to help with those much-needed expenses.
Very important when people think about giving. And before we have to let you go, Erica, Maddox, Livia, how's the fundraising going so far? What's the goal, since you're really up against it ×2? And while you answer, we're going to put the secure web address folks can go to donate online at the bottom of our screen. That's COTA for TeamVentura.com. So how's it going?
It's going pretty good. We started fundraising on social media about a week and a half ago, and we've been steadily raising some money. Our goal is $100,000. So we're hoping to meet that, if not more. And yeah, we're excited about it. So we're going to be working towards some more avenues to raise money here in the future.
Well, hopefully somebody has heard this today and is able to help you out with what you've been dealing with your whole lives there for your family. CODA standing with you and other families going through the same thing. And of course, we will check back in with you throughout this process as the kids move toward transplant. Thank you so much for coming in to share about your lives and what your family's been dealing with today.
We appreciate it.
Yeah.